This afternoon I'd like to discuss intramuscular injections in the horse, a little bit about vaccines, and look at sites that we can utilize for intramuscular injections in the horse. So to start off with, when we talk about vaccines, there are a host of vaccines that we utilize in horses. Some of those we term as core vaccines, which are things like tetanus, Eastern equine encephalitis, Western equine encephalitis, West Nile virus, and rabies. And we call those core vaccines because almost all horses should be vaccinated for those, pending some problem a horse may have with vaccines in general. There are other vaccines that we call risk-based vaccines, and those are things like influenza, rhinopneumonitis, strangles, so forth. Those you should work with your veterinarian, look at what your horses are used for, where they reside, and then determine if your horse would benefit from those particular vaccines. Many people utilize their veterinarian to administer their vaccines, and they do that for a couple of reasons. One reason, while the veterinarian is on your premise or at the clinic doing vaccinations, they also give your horse a physical exam. So that once a year exam may help pick up something early that you may have not recognized. The other thing is you leave the management of the vaccines to the veterinarian, meaning you're ensured that the vaccine is in date, you're ensured that the vaccine was handled properly so that that cold chain was maintained, the vaccine was never exposed to heat, so it should be effective when it's administered to your horse. But even if you utilize your veterinarian to do those basic healthcare things for you, I think any horse owner should be familiar with how to administer an intramuscular vaccine, because sometime during your horse ownership there will probably be a reason for you to try to do this. It may be for economic reasons, it may be because it's more convenient, but there will be some time, regardless of the reason, where you may need to administer either a vaccine or an antibiotic to your horse through the intramuscular route. All right, so let's look at some different size needles, a syringe that we can utilize to give equine vaccines. Some of your individually packaged vaccines, if you order them from a mail order catalog or whatever, they will come with a syringe and with a 20 gauge needle. But if you're buying it in a bulk tank or your veterinarian is giving it out to you, usually we use a 3 cc syringe. It's a fairly small syringe, but most of our vaccines will be a 1 cc dose. There are a few, like some of the rabies, will be a 2 cc dose, but relatively low volume and a very liquid consistency like water to these vaccines. Hence, we normally use a 1.5 inch 20 gauge needle to administer vaccines to horses. And their needles can come in boxes that are blister packs like this one, or they may come in a box that has individually encased needles such as this. The pink or yellow are usually 20 gauge, and I have a 18 gauge needle here which is usually green coated. In my opinion, there's really never a reason to administer a vaccine with an 18 gauge needle. We don't need that large a needle, and there's no sense sticking the horse, with a bigger needle than we need to. And remember that needle size is inverse to the number that's applied to it. So an 18 gauge needle is actually larger than a 20 gauge needle. 16 gauge needle is even larger than an 18 gauge needle. If you also have cattle, then you're very used to using maybe even the 16 gauge needle when you're doing injections in a cow because of the thickness of their hide. They're moving around in the chute and there's a risk of breaking one of these smaller gauge needles. But in the horse, vaccines usually a 20, you could probably even use a 21 gauge needle. Now, doing an intramuscular injection in a horse with antibiotics, especially ones such as penicillin, that is a very thick consistency, we really have to use an 18-gauge needle because of the consistency of the antibiotic to get it to flow through this needle. So there, we do need a larger needle. But for vaccines, stick to the 21-gauge needle. We're not going to actually inject this mare today. There's no reason to poke her. I think we can demonstrate the site sufficiently without actually sticking a needle in her. So I'm going to take a second and put some masking tape on this mare's neck to try to point out where your injection site is on the neck of a horse. In most instances, we choose to do vaccine injections in the neck, and that's for several reasons. One, there's a good muscle mass in the neck of the horse. It's easily accessible. We can usually keep the handler as well as the veterinarian or the owner out of harm's way with most horses. Hence, we tend to utilize the neck. Now, there are certain boundaries we need to pay attention to on the neck of a horse. One is the cervical vertebra. Many people think the cervical vertebra comes across more the middle of the neck, but that's not the case. It comes down relatively low on the neck. You can feel it right in here above this jugular furrow. So that's the vertebral column. We want to stay away from that area. We don't want to inject and maybe hit a spinal nerve or cause a problem that way. The top part of the triangle is the nuchal ligament, which is a very large rubber band type structure that runs from the pole of the horse back to the withers. And that dense elastic structure helps this horse hold his head up without having to use complete muscle strength to do that. And this back edge, that's the edge of the scapula or the horse's shoulder blade. So that's the bottom of this triangle. So if you take your hand and you put it on the horse's neck, sort of like this, in front of the scapula, below the nuchal ligament, and above the scapula, we've got a good area of good muscle to give our injection. So that's where we want to target the neck of the horse. And this horse has two sides. He's got a right side and a left side. So if we're giving multiple vaccines, we can give a couple of them on this side, and then we can move to the other side of the neck and give the others. So we're not putting them all right here in one spot. The one thing, if you're doing it, you need to make sure you notate which vaccines you use on which side of the neck. In case you do get an adverse reaction, you can narrow it down to which vaccine this horse actually had a problem with. And if your veterinarians doing it, they'll do the same thing. A little bit about vaccine reactions. They're like us. You get a flu shot, sometimes you'll have a little warmth, maybe your arm's a little sore. Same thing can happen to horses. Most of the time it's very minor, and you will never pick up that the horse even had a vaccination. There are a few horses that have a little bit more of a reaction. They may get very sore. Some of them will actually be reluctant to move their neck. They may not want to eat for a day or two. Those horses, if it's something that they experience, a couple of times in a row, and we've narrowed it down, it may be several of the vaccines that they respond to, we can do one of two things. We can change manufacturer of the vaccine or different combination of vaccine, because each drug maker uses different adjuvants, which help stimulate the horse's response to vaccines. So they may be allergic or have a response to one adjuvant that company X uses, but not to the one that company Y uses. So we can try that. The other thing, if they really get so sore up here they don't want to eat, we can actually move to the back leg on those horses. They'll still be sore, but they tend to move around if their back leg's hurting, and they'll still eat because their neck doesn't hurt. And we'll talk about these muscle masses. So a little bit on that. Touch a little more on reactions. The cost benefit to vaccines far exceeds the small potential that horse will have an adverse reaction for a vaccine. Most of them, it's a matter of just a little bit sore. If we look at the cost of treating a horse for one of these diseases that we vaccinate with and the risk that some of them have a high mortality rate, like West Nile virus and Eastern equine encephalitis, the benefit to the vaccine far outweighs that. So I think you really need to consider the positive part of vaccinating horses. And again, talk to your veterinarian. You can determine the diseases that your horse may be at most risk of and choose those vaccines, because all horses don't need to be vaccinated for every disease that we have a vaccine for. There's different risks. So again, if we're going to do this in this horse's neck, there's different ways. Some people tend to want to hold the needle, they'll whack the horse's neck, and then they'll stick them. I used to do that, and I don't do it, because I think it tends to make that horse, they wise up pretty quick, and they start to know, when you start banging on my neck, something's fixing to happen. So I'm not the only equine vet that's sort of gone away from that. And I think a better way, if we come up to these horses and we just pinch us up some skin, and we get that skin, and then we're going to take our needle and we're going to go right in front of that pinch. Most horses some will not flinch at all. A few of them will flinch a little bit, and that's that. And we can go ahead and do the vaccination. Now, one thing you need to remember to do, once you've implanted the needle, you need to pull back a little bit on that needle to see if we get any blood in it. If we do, you're going to need to reposition that needle, because we don't want to put this vaccine into one of the small blood vessels that course through the muscles, because that could increase the risk of an adverse reaction on these horses. Now, the sting comes when you go through the skin. So you don't have to completely pull out of that horse's neck. You need to pull your needle out, maybe a little over halfway, and reposition it and go back in. And those horses will rarely react to that at all, because you're not repenetrating the skin. Do a flashback on your needle again, and if you don't get blood, go ahead and inject your vaccine. Some people worry because they've gotten blood in their vaccine, that's going to cause a problem. That causes no problem whatsoever. So just reposition your needle, and if you don't get blood flashback, go ahead and inject your vaccine. Again, that's just the way I do it, but most horses don't react hardly at all. Now, there are some horses that will jump, will shy, and they may, the needle syringe comes out of your hand and it falls on the ground because they've made a fairly drastic jump away from you. If I know that horse, then, and I have one like that, then I'm going to take the needle and syringe apart. Vaccine's in here. I'm going to do my same thing. I'm going to implant that needle, and after they get through dancing around, I'll come back and we'll talk to them, and then hopefully we can reattach our syringe and give the injection. I work on a lot of them. There are a few horses out there that are truly needle shy. They actually panic when they see you coming with the syringe and needle. They're already in flight mode and they're trying to leave the country. Those horses are difficult. They're dangerous to the handler and maybe the veterinarian. Some of those horses need to be twitched just to get a simple IM injection into them. It's because they had a bad experience sometimes in their life and they've never forgotten it. Some of those horses, if you take the time and behavior training, you can actually conquer that. There's some of them, I don't think you will ever get that fear out of them. So when vaccination time comes, when Coggins testing time comes, you just know it's going to be a fight, and you do the best you can for those horses. Those horses, maybe even safer, out of the stocks, twitch so everybody can get out of the way if they blow up. So thankfully, they're not that common, but there are some of them. So we've talked about vaccination up here in the neck and the landmark we can use. So let's say we're giving antibiotics. And if that antibiotic course is going to be a week to 10 days, maybe twice a day, that's a lot of shots. And sometimes that's what causes horses to become needle shy. So what we're going to have to do, because we're giving usually large volumes of antibiotics for many of these, especially penicillin, we may be giving an adult horse 20 cc's of penicillin. We don't want to give over 10 cc's at a site because it's more apt to cause some muscle necrosis, and it cuts down on the absorptive rate of the antibiotic because it's all in one big pool in that muscle. So we try to give about 10 cc's per spot. So if we're going to start with the neck, we can do our shot the same way. We're going to inject, we may give 10 cc's. We can actually reroute our needle like I talked about before and go the other direction and give 10 more cc's without having to do 2 injections on that horse. So that'd be day 1. Okay, now we got to find some other muscle mass to use. The next muscle masses that are the largest and the ones we tend to utilize next are down here on the thigh. You can see hopefully under this stock, this big muscle protruding right here. That's a semimembranosus, semitendinosus muscle, kind of the back of your thigh here. A good site for an injection. The problem back here, as you've probably already realized, she's moving around quite a bit. We're a little bit in harm's way back here when we inject this horse. Some of them, you'll stick them, they'll never move, and you can do your injections. Other horses, as soon as you stick them, they're going to kick. So if we're doing antibiotics over multiple days, we're probably going to be forced to use these back legs, and hopefully we'll kind of be familiar with that horse and we'll know how we're going to deal with it. Bad one, we probably do want them in the stock, so hopefully they're not going to hurt themselves or hurt us. So that's the next big mass of muscles. You can even give vaccines back there if you know a horse gets really muscle sore in the neck, but again, vaccines we usually use the neck. You'll have some people talk about giving injections up here in the top of the hip or the croup. That's a huge muscle mass, your gluteal muscles, but if we happen to get a vaccine site infection and development of an abscess, that's a very hard place to treat. Gravity is not our friend there because it can't drain. An infection down here or even an infection on the neck, gravity is our friend. It'll help the drainage and we can medically manage that abscess a lot better. An abscess up here is very slow to heal and causes a lot of problems. I had a mare at a breeding farm years ago, and she happened to get a strep vaccine up here that abscessed, and it took forever to get that cleared up. So we try to avoid these muscles, but on long-term antibiotic care, we may have to use these. And most of the time, you don't get an abscess formation, but we try to avoid them if we can. So we'd use the neck, we'd use this muscle, we'd move to the left side of the horse, use that thigh muscle, and then we'd move back to the left side of the neck, and we'd just keep going around till we've finished our antibiotics. And hopefully the horse doesn't get to where they don't even want you to come next to them because it's not pleasant for them. There's another set of muscles that we don't use too frequently, and those are the pectorals, or the chest muscles up here. That's actually a big muscle mass. It's just not used very frequently. But again, on long-term treatment, and if we need a new muscle, we can use these muscles up here. Same thing holds. Could form an abscess, but again, it drains easy. It's just not a muscle mass we use very often in the horse, but it's definitely available for use. So I think we've covered the sites for injection. Pay attention to your borders up here in the neck so you stay away from the nuchal ligament, the front of the scapula, and the cervical spine that comes through here, and you'll be fine. And I think with a little practice, any horse owner can give a proper intramuscular injection, and I think all of you should be familiar with doing it, even though you utilize your veterinarian most of the time for those services. So again, discuss with your veterinarian the vaccines that your horse may need, and if you need other advice on how to do it, I'm sure your veterinarian can help you with that.